Hi, I'm Bill Santamore, Managing Editor of Hospitals and Health Networks magazine. I'm in Washington, D.C. for the next couple of days to cover the American Hospital Association's annual membership meeting. Today I'm with Rich Umbdenstock, President and CEO of the AHA. Thanks for meeting with me today, Rich.
My pleasure, Bill.
The meeting always gives members a chance to hear directly from policymakers and Beltway insiders about what's going on in the federal government. What do you expect members to learn this week?
Well, I think several things. First of all, from our friends in the public realm, I think they'll hear a lot about how things are or are not working in Washington and on Capitol Hill these days. I think they'll also hear a lot about the economy and the challenges that our financial situation poses for hospitals as we struggle to maintain the payments necessary from our public programs. And they'll also hear from colleagues around the country, especially colleagues who've been through some pretty enormous challenges recently around some of the man-made and natural disasters that hospitals have had to respond to, and how people, in the case of Hurricane Sandy or the Boston bombing situation, were able to respond so well with no notice at all.
Okay. One of the more popular parts of the meeting is when AHA members get to go to Capitol Hill to meet with their local congressional delegations. What are some of the major messages that they'll be delivering up there?
There'll be three. First of all, no more arbitrary cuts. That's not reform. And we can't continue to take these cuts and provide the level of service, scope of service that our communities expect. Number two, we need to delay the DSH cuts that were in the Affordable Care Act because we're not yet seeing the enrollment for coverage. Certainly that doesn't kick in until 2014 anyway. But we know that a lot of states are not going to expand Medicaid, and there are some significant questions about how effective, how quickly the exchanges or marketplaces, as some call them, will be able to enroll people. So we want to match up the cuts with the coverage, which was the original intent. Thirdly, we are promoting a bill to reform the recovery audit contractor process because of the enormous regulatory burdens placed on hospitals, the unreasonable expectations of these auditors. So that'll be a third thing, to get congressional support for this important bill.
Members of Congress are in recess right now, but when they get back, do you see any sign that there might be a breakthrough as far as the gridlock?
Not unless they hear it loud and clear from their voters. And I don't think over the course of a week that'll happen. So right now, we're not expecting any sort of return to a grand bargain or a new spirit of bipartisanship. We fully expect that the next set of debates will be around the debt ceiling issue as that kicks in sometime around the midsummer. And that once again will bring into question the whole issue of entitlement reform and so on. And we have to be really ready for that debate.
Okay. The next big meeting that the AHA is involved in is the Health Forum AHA Leadership Summit in July. Can you give us a little preview of what might happen out in San Diego this year?
Yeah, San Diego has become a very exciting meeting. It's where we focus on quality and improvement, leadership and teamwork. So you can expect more great learning and member-to-member learning around performance improvement around clinical issues, outcomes, patient satisfaction, but also the transformation of healthcare and how hospitals are moving to more coordinated and team-based care, and how they're starting to merge the delivery system and the financial payment systems toward more effective care overall. It's all about reinventing and improving healthcare, and it's going to be another terrific lineup.
Good. I look forward to it. Well, thanks, Rich, for meeting with me today.